Hello, my name is Jan Sarabia and I'm going to be doing my presentation in nursing shortages. So, for the analysis of the issue, nursing is a really challenging profession and it is a crucial profession that, in fact, a healthcare services would fall apart without nurses. Nursing requires a lot of dedication, compassion, and passion for their job. And this issue of shortages of nurses can be significant because not enough nurses are available to fulfill the demand of the healthcare services. For the following slides, I am going to provide the factors to contribute to this issue, and I will provide an effective strategies of what I think is the best way to address this issue. So, which countries are involved in this issue? For this presentation, I'm only going to be focusing on nursing shortages in Canada. However, this issue is a common concern worldwide, from United States of America, Canada, the United Kingdom, Australia, and many more. The factors that contribute to the shortages are different from country to country, but they all face the same issue. So why is there nursing shortages and what factors influences it? The reason for this issue is aging population. And this makes sense because as the population ages, the need for health services increases. Another issue is aging workforce. So it's not only the patients are aging, so are the workers too. Evidence have shown that most nurses who provide care are 50 years old or older and are nearing retirement, which can lead to fewer senior nurses to train new nurses. Another reason is nurse burnout. The healthcare services requires nurses long hours of work time than any other profession. This demand leads to more nurses experiencing burnout, which ultimately they leave the profession. So based on the evidence, the average turnover is means the amount of people leaving their profession. So the average turnover rates in Canada is 8.8% to 37.0%. I provided a reference list at the very end of the slides for this information. So another reason is violence in healthcare setting. Nurses are in a high risk of violence, physical or emotional abuse are experienced for most nurses. And on top of that, the environment itself is already pretty stressful. The shortages of nurses can lead to longer wait times in the hospital, more workload for the existing and current nurses, and this can potentially compromise patient care. On this slide, I have provided a list of the best way to address the issue of nursing shortages. The first strategy is giving healthcare professionals a better working conditions. Because another factor that I forgot to mention is that the another factor that contribute to this issue that I forgot to mention is that nurses feel undervalued and they do not feel like they are being supported. But if we start creating a better working conditions, we are essentially creating an environment where nurses feel supported, valued, and safe. The second strategy is promote career development. This strategy should allow nurses to have an opportunity to grow in their profession, such as continuing their education, offering them courses so nurses can learn new skills and earn some sort of certification, and providing them with an opportunity to pursue specialized programs. And this strategy helps nurses to grow in their profession and they don't have to stay on the same level on their entire career. The third strategy is allow scheduling flexibility. This strategy allows nurses to work with their desired schedules. This strategy can help nurses to have more personal life, or maybe if they're planning to pursue further education, allowing flexibility on their schedule can help them a lot. And the fourth strategy is hiring international students. This is by far the most important strategy for me because where I'm from, which is the Philippines, I have met people that work in the healthcare fields in the Philippines that are really smart, dedicated, and passionate about their career. And not to mention, nursing is a really popular career in the Philippines. And they often told me how they would do anything to have an opportunity to work as a nurse in a different country. So if we start implementing the strategy of hiring international students, not only this allows to fill the shortages of nurses in Canada, but they can also bring different perspectives and knowledge since they are from a different country. This strategy helps improve overall work environment. And lastly, reduce stress and burnout. As I have mentioned before from the previous slides, nurses require long hours of work time than any other profession. This demands leads to nurses to experience more burnout, which can lead them leaving the profession. But by allowing nurses to rest and providing them with necessary break and taking care of their mental health, caring about their mental health, this strategy can help them reduce stress and burnout. The future outlook of nursing shortages. This graph shows an interesting outlook for the job posting for registered nurses. However, this is in the US, but it does show similarities for the shortages issues in Canada for nurses. And this is also the best graph I could find on the internet that best resembles the nursing shortages issues. So taking a look at the graph along the x-axis, it shows the months, and as a note, this graph only shows job postings for 2022 and 2023. And for the y-axis, shows the amount of job posting in each month. Based on the bars of 2022, you can see that there is a high number of job postings. This means that the US experienced high levels of nurse shortages, and this trend shows high numbers almost throughout the year. Comparing it to the data in 2023, it shows a dramatic decrease of a total of 29% to be precise. We can conclude that 2023 have less nurse shortages than 2022, and hopefully this trend continues in the future. Comparison between Canada and Philippines on this issue. Well, they somewhat have similar reasons for this issue, but for Canada, as I was saying, the reason is aging population, aging workforce, violence in healthcare setting, and also competition in nursing school. But for the Philippines, they also have those type of issue, but for the Philippines, it's mainly people leaving the country to work abroad, and this causes shortages in the healthcare system. So that means less nurse for them because nurses in the Philippines wants to go to a different country because there's higher salaries, probably more opportunities for them. So in conclusion, I just thought I should write it down here. Nursing shortages is a challenging issue that many factors that contribute to it, such as aging population, aging workforce, nurse burnout, and violence in the workplace. However, efforts should be made in order for people to take nursing as their career. One such strategy is increasing nursing programs so there will be less competition and will produce a greater yield of nurses. It is important for the government and community to address the issue because nurses are important in the healthcare services. Without nurses, the entire healthcare could collapse, leaving many individuals untreated. And this is my reference list. Thank you.